Good morning, everyone. Nice to virtually see so many friends. I see Tim McKinney out there and Tracy out there in the audience. I am Pam Neighbors. I'm the President and Chief Executive Officer for CareerSource Central Florida, and have the pleasure of kicking off this webinar this morning, this little teaser, as it will, of an incredible opportunity that we have here in Central Florida, and also in partnership with Project Opioid, extending across our state. But as you all have experienced, as I have experienced, doesn't it feel like we've come through a year and a half of being at a very long and sometimes disturbing but thought-provoking movie, which has been the COVID-19 crisis. Many of us learned many new skills and abilities, and particularly how to be in these kinds of webinar meetings. And this morning, what we'd like to talk to you about is an incredible opportunity that came about during the COVID year and crisis last year. A grant program that actually CareerSource Central Florida, in partnership with Project Opioid here in Central Florida, was able to support the state of Florida to secure, which is actually developing workforce solutions to address the opioid crisis. COVID-19 really and unfortunately doubled and perhaps even tripled the issues related to the opioid crisis. Before the opioid crisis in February of 2020, we were seeing the opioid crisis take the lives and, family members of many, particularly young people who had become addicted to opioids and then were unfortunately suffering from overdoses due to those crises. And that during COVID, with the mental health challenges that we have all faced and businesses have faced, these issues have just been exacerbated. So businesses, as we come back from a COVID crisis and are getting back into our workplaces, have been impacted by COVID. And in fact, the Hartford Insurance Company just recently did a survey, and that survey identified that really 64% of human resources professionals were not feeling equipped to be able to handle the issues coming at them in the workplace from the opioid crisis, or were not even aware of how the opioid crisis might be impacting the families of the workers that they need to make their businesses and organizations successful. And so this morning, we're actually going to talk to you about an opportunity called FORTE, Fostering Opioid Recovery Through Employment Strategies. And I'm excited about this name. In the CareerSource Central Florida world, in the workforce development world, those of you from workforce development out there, we know that we love our acronyms. But I kind of love this because FORTE, the definition of FORTE is something that someone does really best, a skill or a trait that is their expertise. And, in workforce development, we really feel like identifying solutions for businesses, for talent, and also helping people find opportunities is really our forte. But forte also means the strong end of a sword that you would use in fencing. And I really feel like this partnership between CareerSource Central Florida and Project Opioid, which is a partnership of stakeholders across the Central Florida community, led by the business community, our mental health providers, our healthcare providers, social service, and faith leaders, are really identifying ways to impact and make a difference for opioid crisis and help to lessen and reduce the impact of this crisis on our workplaces. We've learned from the best, from Kim Lopdrop at Red Lobster, who was really a pioneer before COVID in initiating a workplace activity. That is part of how we were successful in getting the grant through the U.S. Department of Labor. So this morning, we're going to talk a little bit about the impact on our community of the opioid crisis. We're going to talk about how human resources at organizations can really help to support and work with employees who may or may not be impacted, or whose family members may be impacted, and become part of the solution. We're also going to hear some personal perspectives from some key stakeholders that are out there on the front lines of this crisis this morning. And so I welcome you all again. I am so excited by this opportunity to introduce Forte to the community, particularly the business community. This is such a unique opportunity in our grant to actually reach out and provide real resources, tools, and training to our business community. And you're actually going to next hear a message from my partner in this endeavor, Andre Bailey, who is the founder and executive of the Project Opioid and Create and Change Everything organization. And so we have a message from him. He was unable to be with us this morning, but do we have that queued up? Yes, thank you very much. So take it away, Andre.
Pam, thank you for the introduction, and thank you to everyone who's joined us today to hear more about Forte, which is our new community program meant to take on the overdose crisis by impacting the workforce that can help undergird solutions that can save lives. I'm again Andre Bailey. I'm the founder of Project Opioid, and I'm one of the team members that worked to bring this grant into our community, and I'm so excited about the possibilities. So here's what you need to know about Forte and about our partnership together to impact lives. Number one, our community has received $2.7 million of government funding to invest in you. If you're watching this, we want to invest money. We're not here to raise money from you. We're actually here to invest money in your company, in your church, in your organization to impact the opioid overdose crisis. So that's the first thing to know. We're here to invest resources that we have drawn down to help you impact the overdose crisis. So that's number one. We've got $2.7 million to invest into the community. All right, so what do we want to do with that money? We want to do a few things. Number one, we want to train the trainer. We want, if you're a CEO, a corporate leader, a faith leader out there, we want to get a hold of your HR director, those that do your EAP programs, and we want to train them on how to create organizational capacity for this overdose crisis. The new front line can be your company, your church, your community that you're touching, and we want to use these resources to help you do that and be a part of that. That's number one. Number two, we want to train you on how you can use NARCAN and have those in your workplace, in your house of worship, be equipped with NARCAN to be able to respond to overdoses if they might happen in your world. So we've got NARCAN training available. We're going to do lots of ways of showing you how to get NARCAN into the hands of your company and your people. And number three, we want to work together ultimately to train and hire that next generation workforce that can impact this overdose crisis. As many of you have seen, we all knew that there was an overdose crisis before 2020. We had heard the stories of big pharma in the overprescription crisis that happened, and those stories are true. But you need to know this, that the data that's come in since the pandemic started in 2020 shows in this community and around Florida, overdoses have increased at record numbers, with communities like Central Florida and beyond seeing 40, 50, even 60% increases in deaths in just 1 year since the pandemic began, with a lot of these deaths happening with young people, vulnerable communities. And so this is the moment where we have to respond. And part of that response is going to be a workforce who has the ability to navigate people to help. HR directors, like we spoke about, who are equipped inside of their company to help folks. But it also might be those who have struggled previously with these substances, who were trying to use their struggle now for a purpose to change other people's lives. Again, all of this is what Forte is about, and the $2.7 million that Career Source of Central Florida has drawn down to invest in this community and beyond this community. So you're going to hear a call to action today later on in the presentation. Don't let this webinar go by. I know we all have webinar fatigue, but don't let this webinar go by without taking that next step where your company, your church, your organization can start investing in that workforce of tomorrow that will save lives in Central Florida. Again, I'm Andre Bailey. If you need anything from me, reach out directly to me if you have questions. And we're so thankful to have leaders like Pam Neighbors, her entire team, and everyone at Career Source of Central Florida leading the charge with Project Opioid on this crisis. Thank you so much.
Thank you, Andre. Good morning, everyone. Lisa Nason is my name. I'm the statewide director of public policy for Project Opioid. You just heard from our founder and CEO, Andre Bailey. I'd like to tell you a little bit about Project Opioid, the model that we use, and how and why this is so important for business to be involved. When you think of public health crises, COVID is an excellent example. You think of the organizations that are typically activated to respond to an emergency. Government, we saw that, but whether it's government providing access to treatment or providing dollars to public service providers, they are key to solving public policy crises. Education, Andre talked about the data that's coming in. The role of researchers and the education community is absolutely vital. Just this past Sunday, the Orlando Sentinel they featured a fascinating Associated Press article. It was titled "The Opioid Crisis, an Epidemic Within the Pandemic." And that's exactly what this has turned out to be. While the pandemic naturally received so much attention, there have been a few public health crises brewing within that. Research is key to unmasking that. Service providers, of course, we know our trusted community partners, healthcare treatment providers, and of course on the front lines are criminal justice and law enforcement. Who is typically not activated? Faith community, we know what an important role they play in the community, but you don't naturally think of faith community as a part of a public health initiative. Project Opioid brings in these non-traditional community leaders: faith community, philanthropy, and finally business. Business is the heart of so many families. It's the heart of insurance options for so many folks. So while you may think you don't have a problem, let me tell you, the data absolutely shows that we do. Overdoses are now the leading cause of death for Floridians aged 35 or younger. The leading cause of death, almost exclusively, that is by opioids. There's another terribly disturbing trend between the disproportionate rise of overdoses among communities of color, 110% increase among Black Floridians, and 68% among Latinos. Millennials fall into the same risk category. Those aged 25 to 44, although they comprise only 25% of our statewide population, right now they account for more than 50% of the overdose deaths in Florida. As we will hear in a moment from Captain Gibson, next slide please, as we will hear from Captain Gibson, if you don't know that individuals in active addiction or those affected by addiction are in your workforce, they are in your workforce. That's why we need business leaders who are committed to action. Certainly for the health of your business organization, you want to have as healthy a work population as possible, but also by creating an environment where employees can seek help, whether it's for themselves, whether it's for family members. Your workforce is impacted. The statistics don't lie. It's now my pleasure to introduce Captain Sammy Gibson with the Seminole County Sheriff's Office. He is a very special guest who serves on the front lines of this epidemic every day. Captain Gibson is with the Drug Enforcement and Behavioral Services Division. He has more than 30 years of experience as a law enforcement officer. In addition to that, he has a couple of decades of service coaching Seminole County's youth in a variety of sports. He is genuinely in touch not only with your employee pipeline, but with the youth who are coming into that pipeline. This morning, Captain Gibson is going to be sharing some firsthand observations about the opioid epidemic and how it's impacting our communities. With that, Captain Gibson, I say good morning. We're so appreciative of your time as well as your service to our community. We're so pleased to welcome you this morning.
Good morning, and thank you very much, Lisa. As she said, my name is Sammy Gibson, and I'm a captain with the Seminole County Sheriff's Office, and this is actually my second go-around with the Sheriff's Office. I retired in 2016 after having served 36 years with the sheriff's office in Seminole County. I started my career in 1980 at the age of 18. And so primarily all of my 36 years was in the field of drug enforcement. And I also, during that time, as kind of a stress relief, I coach youth sports. I still coach youth sports in football and baseball, and I had 15 years experience as a high school coach. I will tell you this, after serving 36 years and doing this my whole adult life, actually, I can say with 100% certainty that drugs and drug addiction have no prejudices. I can tell you that it doesn't care what race you are, what sex you are, how old you are, what religious preference you are, or what your financial status is. It doesn't care. It affects literally every human being out there. It has no prejudices. They also say that 1 in 3 people know of somebody battling addiction, and I feel confident in saying that those numbers are low. I think it's much higher. I'm actually confident in saying that anybody that is watching this webinar right now today, or who will watch us in the future, you know of somebody that is battling addiction. You may not know that they're battling addiction. You know somebody who's battling addiction. In 2019, I was retired, but in January, I met Sheriff Lima, Seminole County Sheriff. He's wonderful. Met him for a cup of coffee for a 10, 15-minute conversation. And he had just been appointed the Attorney General's, chairperson for the Attorney General's Opioid Task Force. And he had asked me, he said, Sammy, you've done this for 36 years. He said, what's your take on this opioid crisis? And I told him, I said, Sheriff, I said, this crisis and epidemic is like nothing we have ever seen before. This makes the crack epidemic of the mid to late 80s look like an elementary school boy. This is something that we are going to have to use non-traditional law enforcement techniques to combat if you really want to win it. We're not going to arrest our way out of this. We need to refocus. Our focus should not be necessarily on arresting and incarcerating sick people, but we should be thinking about and focusing on making sick people better. And of course, we have a 3-prong approach and always have in law enforcement, and that's enforcement, that's education, and that's treatment. And I told them we need to really, I know this seems crazy coming from a 36-year drug enforcement agent, but we need to focus our efforts on treatment and identifying what's going on. To give you a little idea, in 2018, we had 646 overdoses in Seminole County. 82 of those overdoses were fatalities. They were fatal overdoses. And I can tell you, as a 36-year veteran, I did not associate with career criminals. I don't associate with drug traffickers, drug dealers. But when the sheriff asked me my opinion on this, of those 82 people, I personally knew 4 of them. I knew 4 of the 82 people that died the year before. 2 of them were young men I had coached through youth football and even coached in high school. They had both sustained injuries during high school careers. They were placed on prescription drugs, and ultimately one died at 25 and one died at 26 of a drug overdose. The third gentleman was somebody that I actually coached with. He was a volunteer coach that owned his own construction type business that sustained an injury, was placed on prescription pills, and ultimately overdosed and died. The fourth one was a close family member. I'm going to start talking quick because I'm limited on time here. But let me try to put this in a little bit better perspective for you. In 2018, Seminole County had 82 overdose deaths. State of Florida had 4,698 overdose deaths. That's 12 people a day, Floridians, that died. There was over 70,000 people died in this country in 2018 from overdose deaths. That is more than the total number of servicemen and women that died during the entire Vietnam War. Put it in a little bit further perspective, there was 2 commercial airline crashes that happened in 2018. One was an Indonesian airline and one was an Ethiopian airline. 189 people died in one crash, 157 people died in another crash. So to put it in a little bit further perspective, of the 70,000 people, that's 193 people a day. 193 people a day die in this country from a drug overdose. Imagine, well, let me back up on the air crashes. After those 2 crashes, the FAA and the federal government immediately grounded those aircraft, and they started having Senate hearings on Capitol Hill to get to the bottom of it. Imagine waking up every day and turning on the news and we had another airline crash today, 193 people died. Tomorrow you wake up, 193 people die. Every day we're averaging 193 people dying. So anyway, Sheriff Lima asked me, he said, you know what? He said, I need you to come back and head up our opioid initiatives here in Seminole County. So needless to say, that's why I'm here. I started work the very next day. When I came in, I had to ask myself, where do we start? And I can tell you the first thing we need to do is we need to change the face of addiction. We need to change the stigma of addiction. These people that are dying, they are not the typical homeless person living under overpasses. They are not somebody living in a dark alley in some blighted community. These people are good, law-abiding people that, for whatever reason, they turn to addiction. We need to treat this as a disease, which is what it is. And nobody wakes up one day and says, I'm gonna throw away everything I've worked for to die with a dirty needle in my arm. The two young men I spoke to you about, they were good, hard working young men. The gentleman that I coached with that died owned his own business. He was self-employed. He hurt himself. He had a back injury. His option was either to have a back surgery and have to rehabilitate for 12 to 16 weeks, which time he would not have been able to support his family, or remain on pain pills, which is what he ended up doing in order to support his family, and ultimately died of the overdose. And the one I didn't mention was my first overdose death investigation when I came back was a 19-year-old female. She was 16 years old at the time that she had serious dental work, and they put her on prescription drugs. And 3 years later, she ultimately died of an overdose because of her addiction. We have to change this. We have to change the face of addiction. We have to change the stigma. The problem is nobody wants to acknowledge it because it's taboo. It's a bad thing. It's an embarrassment to people. But I remember growing up as a kid, when I was young, my uncle was an alcoholic. And I remember my parents and my aunt saying, when we go to gatherings, if anyone asks where Uncle Bill is, just say he worked late or he's not feeling well. No, it's because he was on a 3-day alcoholic binge. But it was an embarrassment then, but it's not today because we've accepted it. We understand it's a disease and we move forward. And that's what we need to do here. We need to change the face of it. We need to change the stigma. And listen, I will tell you, this isn't just a law enforcement problem. It's not just a medical hospital problem. It's not a treatment and clinician problem. It's not a problem just for our educators. This is everybody's problem. This is a community problem. This is the biggest epidemic truly that we have faced in the 59 years I've been living. And we all do what we do best. I mean, law enforcement does a great job, but we work in a silo. Hospitals and medical fields work in silos. Our educators work in silos. It's our silo, and we do good at what we're doing. Here's how we address this. We have to tear down these silos, and we have to have a holistic approach. We have to all come together and do our part to stop it. It's our problem. It's everybody's problem. It's a community problem. And so we need to change the stigma in order to do this. It's going to take everybody, to include our faith-based leaders, our businesses, and our business owners. And of course, this is geared more towards our business owners. And if you own a business, you run a business, you ask, what can we do? What can we do? First thing we need to do is we need to change the face of it. We need to change the stigma. We need to understand and let people know it's okay. This is a disease. We need to be able to identify those that are in need of services, that work for us and work with us. And we need to be able to provide services or help that person navigate their way into services back to the road to recovery. We need to take an active role and be a part of creating healthy communities within Central Florida. And that's what's so important. This, I tell you, listen, this last year, 740 something overdoses. We are responding, my people are responding to 2 to 3 overdoses a day in Seminole County. We're averaging every other day an overdose death. This is real. These are our neighbors. These are our children's friends. These are our coworkers. These are our next door neighbors. These are family members. You may not know it, but we need to be more cognizant of it. We need to help identify it, and we need to get rid of the stigma, and we need to try to get these people in services. You know, here's the deal. It takes all of us. And I mean, the business owners, the faith community, law enforcement, medical clinicians. Listen, that we all have to come together. We all have to come together and do the right thing on this. Because listen, if we all don't do it, who is? This is our community. These are our people. If we don't come together and do this, who's going to do it? And I will leave you with this. This is what I tell those people that work for me that respond to overdoses every day. Failure. Oh, there's my failure is not an option. You understand? Failing in this endeavor is not an option. People are dying at record numbers. So I leave that with you. Come together, do the right thing. We all need to take our part in the stakeholder, and because failure is not an option. And I'll leave it with that.
Thank you so much, Captain Gibson. And it just flows perfectly into our next topic. Lisa and I are going to talk a little bit more about that impact. You know, how does not addressing substance use impact the business, and how can businesses be a little more proactive? So this is a little bit of a sneak peek of what we are going to be doing in September for HR training. We really want to make sure the business understands that, yes, the well-being of the employee is impacted. The most important resource in your organization, your employees are being impacted. But as Pam mentioned, it isn't known, it isn't heard yet, and that's what we're trying to make sure happens. So according to the National Safety Council, 1 in 12 individuals is in your organization with substance use disorder. This number actually increases in certain industries like construction to 1 in 5. So day in and day out, your employees are already being impacted with substance use disorder. On top of that, as Lisa shared, the age of overdoses is that prime workforce age. 95% of overdoses happen between 18 and 64 years old. So individuals are being taken out of the workforce that could be great contributors. And we know we want to try and help to make a business foundation that's supportive of employees in order for them to overcome the stigma that is associated and help organizations understand how they can be a part to help. This graph that's on your screen is actually showing the labor force participation rate decreasing. According to a Princeton economist, over the 16-year period, 20% of the decline in labor force can be attributed to prescription use within the workplace. On top of that, in our state alone, in Florida, 128,800 prime age workers were drawn out of the workforce, impacting our economy. The estimate is that it would have grown 40% faster if these individuals would have been able to stay a part of the workforce. A lot of times, opioid use is started without known. It's prescribed to you. Maybe a doctor didn't explain that it is an opioid. And when this happens, sometimes it's associated with an injury in the workplace or an illness in the workplace. In a study done in Connecticut, 1 opioid prescribed can equal 4 times the workman's compensation that a similar injury without opioids would have had. So there is a cost implication here beyond the well-being of your organization. So how does untreated substance use disorder impact your organization? It's estimated that about $8,255 a year is an impact per an employee with an untreated substance use disorder. This number increases to over $14,000 in certain roles, like an executive or a role that requires additional training. The cost in there isn't just the days missed of work, but there's more to it. There's employee retention costs associated. There's the presenteeism that keeps coming up quite frequently, the increased health visits to the hospitals, to the doctors, to the ERs. On here, I have a little bit about the absenteeism increasing, and something that I find fascinating is that an average person misses about 15 days of work a year. An individual who is not identified as struggling with substance use disorder misses 25 days. So that's 10 more days a year. However, when you get that individual into recovery, their absenteeism actually decreases below the average to only about 10 days a year. So there's also a wonderful effect within the business of having someone more engaged, more involved. The same thing actually happens with turnover rates. So the average person with substance use disorder, it's about 36% turnover. Prescription pain use goes up to 42%. An individual with no substance use reported is at 25%, and yet an individual in recovery is more likely to stay with your organization at 21%. So the turnover rate decreases. And this is just some of the information that we really want to go into when we get the HR professionals engaged in our centers and learn how they can be a part of the solution. How can businesses be a part of the solution? So here's a framework overview of items that we definitely want to discuss and engage with in the training. We want organizations to be more proactive, have the conversation, overcome the stigma. A lot of times stigma is associated because we just don't understand. So educate yourself. What is opioid use disorder? What is substance use disorder? How does the brain change? How can we help make sure that individuals are more proactive and engaged in conversations with their doctors to understand what they are being prescribed? Leverage your EAP programs. 95% of organizations have an EAP program, yet it is so underutilized. And a lot of times it has to do with the stigma of addiction or the concern of confidentiality. So let's get messaging out there that helps clarify what the EAP program can do and how beneficial it can be for your employee. Furthermore, we want to engage the employees. So we want to get communication out there so that employees understand how opioid use disorder and substance use disorder are impacting the workplace. And then let's look at our healthcare plans. Are there opportunities to help educate on when prescriptions maybe aren't necessary? Maybe there's a pain alternative. And with this, it will help the organization not only save in the business costs, but help with the well-being, which is such a focus, especially after COVID. How can we benefit by being a better organization and looking at the employees' overall well-being? In the training, we're also going to share some great resources that are out there existing already today. The National Safety Council has this amazing calculator that I'm going to show you in just a moment of how it breaks down costs so that you can see that your organization has X amount of people impacted. SAMHSA also has a great opioid prevention at work resource. It gives you an overview of ways that you can look to help prevent the impact. A dictionary is something that I'm very passionate about. I just came across this resource, and it helps you understand when words have a stigma associated. So we're trying to change the language. We want it to be substance use disorder. We want it to be opioid use disorder. And this will help you identify words that maybe you don't want to use in your communication because it's not being inclusive and it's not welcoming the individual to come forth and be able to say, I do need help, or I need to have these resources available. And then Lisa has an excellent overview of NARCAN and something we're desiring to get into the workplace in our first aid kits, especially as we return to the workplace. Let's refresh that first aid kit. So as I mentioned, there's this wonderful calculator through the National Safety Council. And it gives you the opportunity to input how many people are in your organization, what state you're located in, maybe your organization's in multiple states. And then there's 16 different industries that you can actually select from. If you input your email, what happens is it will send you just the direct link so you can return to the calculator. But it breaks down the cost. So it tells you this is your annual cost that you are losing towards not identifying and helping individuals understand substance use disorders in the workplace. It breaks it down by the loss of time, the turnover, healthcare, gives you the estimate of how many days are missing, how many employees are impacted, but as well as how many of their family or their dependents are impacted. It's a great tool to be able to just sort of give you a snapshot. It will be updated in the future with COVID numbers. That data is not in there. So I would expect all of these numbers to just grow. But when we finish today, we are going to send out an email with some of these links so that you can have the opportunity to engage and look and be a little more proactive before the September training. Lisa is going to share some wonderful information about NARCAN now.
Thanks so much, Mara. And again, good morning, everyone. The most important fact that I want to impart regarding NARCAN, it's non-toxic, it's non-narcotic. It's not a substance you have to be worried about having in your workplace. And as part of the training that will be kicked off in September, we'll talk about boosting the capabilities and the inventory of your on-site first aid kits. We've become very adept in accepting of AEDs. Those used to be extremely exotic. They are now an entire network of AEDs that are around and people that are trained to use them. Same thing with stop the bleed and tourniquet flow utensils. They are genuinely life-saving in the workforce. It's the same with NARCAN. The training that we'll do as part of the seminars is going to really show you how extremely easy it is. It's not even as invasive as, let's say, an EpiPen, where you have an actual syringe and a needle that has to go through clothing or into a body part. It is literally just a one-dose nasal spray. And again, I want to stress, you are not bringing a toxic substance into your workplace. It's non-toxic, it's non-narcotic. If someone were to accidentally be administered a dose of NARCAN, it would have no negative effect. It only has the positive effect of interrupting an overdose. So you'll be learning a lot about that as part of the training. And Mara, I appreciate the opportunity to speak about that. It's now my opportunity to introduce our next speaker. Joe Dimitrovic is an outreach and resource specialist for the Central Florida RAISE Project. He has over 35 years in long-term recovery. After his 37-year tenure working in the private industry, Joe moved into the field of helping others. His passion for recovery led him to serve as an original board member for the RAISE Project, which was in Pennsylvania. Later, he moved into the role as a recovery coach with the Dauphin County Drug Court. He has been instrumental in forming relationships and assisting in the development of the RAISE Project's community organizations, both in Osceola and Brevard counties. Joe's goal is to reduce stigma, to be an advocate, to promote multiple pathways to recovery, and to provide recovery support services to any individual seeking a better way of life. Joe, good morning and welcome. We're so pleased to have you with us today.
Good morning, and thank you, Project Opioid and Career Source. As you were stating, I didn't realize I did so much stuff. I need to change my resume.
Right.
But to get started, I want to say that I am a person in long-term recovery. And what that means to me is I haven't had a chemical since October 7th, 1985. And I'm saying that because during that time, I have been employed, gainfully employed, and I vote. I'm a community member. I'm a church member. I coach junior high basketball. I had to laugh when Sammy mentioned that. I was like, that's a challenging job. That should be on the top of my resume. But anyway, I came to Florida in 2017, and as Lisa mentioned, I was a certified recovery specialist for drug court, and I started that position in 2015. It was a pilot program, and I was the recovery coach for individuals, men, who were entered into drug court, and they wanted to measure the impact of a certified recovery specialist. So after 9 months of being on the job, the graduation rate went from 25% to 62%, just by having an individual, a peer, somebody that is not saying those people, it's we. We are people, that are all together in this epidemic, as was mentioned prior to me getting on here. So, I want to say that and Sandy mentioned this, that the silos that are out there with law enforcement, employment, healthcare, and even treatment providers. I represent a recovery community organization. And what that means is the people that work there are all peers. It's peer-led, peer-driven, and it's about the community. So organizations like ours and many others over Florida will break down those silos, because we don't have a an agenda or a connection to a system. We're neutral. So anyway, so just a little bit about data. Illicit drug use accounts for 49 billion in reduced participation, which is lack of unscheduled time off, as Mara had mentioned. Opioid misuse, prescription opioids, accounts for $0.9 billion. That's a lot of money, and that's just in the workforce that it's measured. So what I have to say is sustained recovery is tied to meaningful and purposeful work-life balance. So employment is important to sustained recovery and financial independence. So, as mentioned about SAMHSA, the 4 pillars of recovery to SAMHSA are health, home, purpose, and community. So I'll tell you a little story about myself. I'm being mindful of the time. I started working in 1975 at a floor covering distributor, and for the next 10 years, I was engaged in IV heroin use. So I was not a very productive employee. However, I somehow managed to maintain my job. I wouldn't take off 15 days. I would take off 6 months. I would go to however long short-term disability would end, and then I would go back to work. So I would have gaps of unemployment, but while being employed. So, over my career there in 10 years, I was not the best employee. I would probably be labeled as the worst out of 250 employees. We were a small floor covering distributor. So anyway, in 1985, the chips fell all in line. I had a moment of clarity, and I decided to enter into recovery. So from that point, 1985 to when I left in 2009, I had become a warehouse foreman. I had become the operations director, and I had then transitioned over into sales as a regional manager. So here was a person who could not, and when I first started working, I made $2.85 an hour. So you can equate that into the scale. That's not much money. Even back then, it wasn't much money. And then as we move forward in my career, first of all, in 1985, when I had gone into recovery, I had known my chief executive officer, and it was a small enough company that I went to him and I said, look, I have a drug problem. I'm a drug addict, because that's what the language was back then, or, that's the way we talked about ourselves. Today I have substance use disorder or substance misuse. And I went to him and I talked to him about my situation. And he said, oh, by the way, he said, I had a person, he was a member of the YMCA. And in working out there, he had met an individual who had ran an outpatient facility. And I guess he used to talk to him about me and how to deal with me. And, the guy told him, and he never met me before. He said, first of all, don't fire him. If you think he's a valuable employee, give him a chance. And, that was something unheard of back in 1985. But this gentleman took that risk, and, and we went so far as to bring him into work one day to meet me, but I, of course, wasn't there. So, that whole plan was blown out the window. But anyway, as I entered into recovery, I thought it would be a good idea. I joined the Y, and I met that individual who he had arranged this meeting with, and he became a mentor in my life. So, recovery works in mysterious ways. I think if you're putting yourself in the right position and you're around the right type of people, things start to happen. And as far as the workforce and the workforce of the future, and turning this opioid epidemic around, in my opinion, is with peer support, certified peer recovery specialists. And it's in the state of Florida, we're just starting to enter into that realm of employment and deploying these individuals in certain places which we are effective, such as hospital settings, emergency department, a treatment, detox, or outpatient facility, jail reentry programs, medication-assisted treatment programs, and also we are employed at recovery community organizations. And our organization spans over 2 states, and we employ 60 individuals, all coming from recovery from active addiction. That's an astounding amount of people. So, you know, we make a very large impact in the community. And I think that we are growing because the state of Florida has formed several RCOs through a grant through FATA to create these organizations, and they're strategically placed throughout the state. And I think that as time goes on, you'll see the impact that we will have in this workforce development, because that's what we're talking about. If somebody's going to feel good about their recovery, we have to have purpose. That's one of the 4 pillars. And one of the ways to get purpose is gainful employment. To feel good, to be able to support your family, have a job that gets you health care benefits, that you're not a contractor, that you're somebody that's on paper working for somebody, and you're a valuable asset to that corporation or restaurant, wherever it is that you work. You know, we are valuable people. To have active addiction is no small feat, and the resources that it takes for just one person to cross that line and say, I'm going to take a risk. I know I have substance use disorder. I don't know what to do about this, but I'm going to go seek help from somewhere else other than what I've been doing. And, you know, when individuals do that, it's very important that the rest of the community, you know, healthcare and workforce development is there to meet us, because many of us are untrained, or we need to regain what we've learned, or re-educate ourselves, or make ourselves appealing to employers. So I think I've used up all my time. It's 10 minutes, and I would like to once again thank you, Maura. Thank you, Lisa. Thank you, Project Opioid. We are also a partner and working with Project Opioid. So I'll sign off now. Thank you.
Joe, thank you so much for your time and your insights. We really appreciate it, and thank you for sharing your story. As Joe mentioned, this is a community effort and something that we need to stay focused on across every level or strata of our community. That said, we want to provide some resources, some ideas to help get you involved and engaged. We wanted to start off by mentioning that FORTE will assist at least 2 types of career seekers: those that are interested in joining the next generation healthcare field, those that are interested in helping to assist with recovery, and of course, those that have been, as Joe pointed out, directly impacted by the crisis. We want to be able to provide those resources for those individuals to, again, impact this community. Additionally, in August, Project Opioid will again partner with CareerSource Central Florida and offer that very important NARCAN training. That will be an in-person event where you'll have a NARCAN distribution. More to come on that. In September, which happens to be National Recovery Month, FORTE will begin to offer quarterly training for HR professionals, sort of focused on preparing businesses to be proactive in engaging employees on substance use disorder and, of course, opioid use disorder. Training will essentially highlight an overview of substance use disorder and, of course, opioid use disorder, how addiction impacts the brain, how substance and substance use disorder impacts your business, right? Provide tools to help build a recovery-friendly workplace, and of course, share firsthand accounts from individuals in recovery and how they can contribute to the success of business and developing a sort of a reintroduction plan, if you will. Also, that very important NARCAN training and implementation, we'll talk through how to develop a workforce training program in regards to NARCAN. Next slide, please. Of course, we'll focus on a limited registration, but will be open soon for that NARCAN training in August. Those will take place at our career centers. And then we would invite you to come visit us at the Florida Human Resource Expo, which is taking place August 29th through September 1st at the Gaylord Palms Resort and Convention Center. I believe registration or pre-registration is required, but most of you on this call will likely be there. It's a general conference, but we'll be there to discuss this very important topic for our community. And then again, just to reiterate, launching in mid-September at our West office, CareerSource Central Florida's West office located on Colonial, we will start the first of our quarterly human resource trainings. And then, of course, after this webinar, as Maura pointed out, we'll be sharing an email with some of the resources that we mentioned today, as well as share additional information and how you can become and how you can seek assistance and guidance as you move through this opioid epidemic and crisis. We obviously want to be working with you to create impact in our community and end the opioid epidemic. Additionally, we just want to thank everyone who's had an opportunity to participate. All of our guest speakers, Project Opioid, of course, everyone here at CareerSource Central Florida, and all the participants. If there are any questions, please feel free to open up your microphone at this time, and one of our very esteemed panelists will have a response for you. But thank you very much for your time and for coming today.
So I'm Karen Schreiber. I'm the Executive Director of the Volusia Recovery Alliance. I want to thank the speakers and Project Opioid for putting on this seminar today. As I put in the chat, one big barrier in recovery is level 2 background checks. And I was wondering, as a group / community, what you're doing to remove that particular barrier for people in recovery to gain gainful employment. Thank you.
I can take that question if you want.
Thank you, Joe. That would be wonderful.
As a part of Floridians for Recovery, I am on the advocacy committee, and we're just shy of, we have a rough draft on a bill addressing level 2 background screenings, and we're going to meet with a representative in South Florida on Wednesday, have our final draft presented, and then get legislative support to at least reduce the amount of time that individuals, not individuals, but through the exemption process, they can go back as far as 50 years if they want to check the criminal record. And also they can check on crimes that you've not been convicted of. So we've addressed some of those issues in our bill, and hopefully it will gain some traction and support. And in 2022, we'll have a little adjustment to that.
Fantastic. Thank you, Joe. Any additional questions?
If I can just add to that, CareerSource Central Florida also offers a workshop that's specific for individuals that are career seekers that might have some sort of background implication, justice impact, to help them understand how to navigate the system that currently exists. As Joe mentioned, we would love to have the legislation move quickly, but as of today, we do offer tools and resources to help them understand what's available, what's out there today.
And Karen, this is Pam. I would say in Volusia County, that's available through the CareerSource Flagler Volusia with my colleague Robin King as well. And I think also it might be interesting or helpful if you know of specific sectors or areas where the level 2 background check is a challenge, because as we begin to develop a workforce to respond to the opioid crisis and identify areas for people to get skills and training, that'll be an important consideration. So we welcome your feedback directly to Maura on that particular issue.
I have a contract with Robin to do a similar thing for Volusia and Flagler, but it remains one of the biggest barriers that we have, and I am working closely with Robin on it. So thank you very much.
Yes, and Flagler Volusia also is a part of the statewide opioid addiction employment workforce program.
And also for Brevard County, we do have the RISE workshops that's available that I do facilitate. We do that online and also face-to-face on site. So we talk about those barriers. We talk about how to address those, disclose the conviction to the employers, informing them about the incentives, the federal bonding, the work opportunity tax credit, to ensure that the supervisors or the employers to have that advantage, to get that advantage, and let them understand that what a great opportunity to focus on their skills and their abilities, not their barriers. You know what I'm saying? So for as with individuals who have a background or individuals who are struggling with the substance use disorder, we are able to motivate and empower individuals to how to sell themselves to those employers. what can you bring to the table? So we do have the RISE workshop here at Career Source Brevard too as well. So we were very successful with the RISE program that occurred in 2019 as a special grant. We were very successful getting individuals jobs, finding them career pathways, and also being self-employed. So I just want to make sure that, you know, we're all working together on this. So I'm very happy to hear that.
Can you put your phone number in the chat? Because I'd love to talk to you directly some more, please, about that.
Absolutely, Karen, absolutely. One team, one goal.
Right. We're in it together.
All right, any other thoughts or comments before we close out today's session?
Yes,
Cliff, go ahead, Houston.
it's Houston Spore. Question, when will peer recovery training begin and who will that be through?
I can answer that. So we're working closely with the Central Florida CARES Health Systems, and Maria, who's there, is actually looking at offering the next training in September currently with her partner from DCF. And they're able to do that full training, the 40 hours required for the peer specialist. She's also said to us that if we have a group of individuals that are identified that are ready and want to do it, she will do a special training, and we'll be able to do that and use one of our career centers in order to make that happen. That's something we're definitely passionate about. We really want to get more peer specialists out there. It's an amazing connection in the system to how navigate the waters of recovery. It's just incredible what it's done. So yes, we're working closely with them.
Perfect. That's wonderful to hear.
Pam?
Oh, Cliff just wanted to close out and thank everyone for being here. And please, we actually have a FORTE page on our website, www.careersourcecentralflorida, all spelled out, .com / is it FORTE or opioid recovery, Maura?
It's FORTE.
FORTE, all right. And so a lot of the resources, and very important that you stay tuned with the network, particularly those of you in the business community, the training that Maura talked about, our partnership with SHRM. We're also seeking to get and have our HR professionals receive CEUs for that training, which is very important. And also, you know, learn from one another on how to combat this crisis. So Cliff, thank you for taking us home at the end of this.
Absolutely. Thank you all. Have a
Have a great
fantastic
day.
day, everyone. Thank you, everyone.
Enrique, do you have a question?
No, I didn't necessarily have a question right now, as I know several of the people that are present here, but I was wondering if it would be suitable to add some resources that are, it wasn't mentioned, that are definitely in line with what we're talking about here. If I may do that and put it on the chat, and maybe you can distribute that later, I will be happy to do that.
Thank you, Enrique. Absolutely. Happy to do so.
Very well. I will put that in there in the next couple of seconds. About 3 resources. The FRRC that is providing funds, and it was very instrumental with the Amendment 4 for voting. They're not affiliated with any political party, but they have collected a lot of money to pay for fines and fees and training and a bunch of other things for individuals that are returning citizens, so that, you know, they can become more employable naturally. And I'm putting those resources in the chat right now as we speak. I'm over here seriously multitasking.
Thank you, Enrique. And bye, I have to run, everyone, but thank you again for being here.
There it is. There it is. It's up now. Thank you.
Thank
Bye.
you.
Wonderful.
Thank you all. Thank you very much.
Thanks, Cliff and Lisa, for having me.
Thank you, Captain.